Hi, how are you?
I'm great. How are you doing?
I'm
That
good.
is good. I'm so glad to have you with me. I'm Lawana. I'm one of the faculty members here at Regis College in the graduate nurse practitioner program. And
Um,
I'm so glad to get to talk to you. So we reached out to you because you and I have something in common because I graduated from the University of Cincinnati. I did
okay.
my women's health nurse practitioner program there at the
All right,
University
go
of Cincinnati.
Bearcats.
Yeah, so that's how I was able to see because I still get the alumni information, and I was like, oh, we have some people that got awards. I want to talk to them. So it's so great. So I want you to introduce yourself and just tell us where your practice is right now, so that way students and other folks that are listening will have a background for our conversation.
Absolutely. So my name is Felicia Beckham. I'm a board certified family nurse practitioner where I currently work at University of Cincinnati. It's the Department of Family and Community Medicine. I'm under the geriatric division. So I currently round in their nursing homes and their skilled nursing facilities, and also their independent and assisted living facilities.
Okay, that's wonderful. So I always like to start with finding out, why is Miss Felicia a nurse? What happened? Is this like a childhood dream? Did you kind of meander into it? So tell us that story.
Yeah, so honestly, I really just wanted to get away from my sister. We are 18 months apart, and for some reason, we've always been together. So I went to Hughes. She's 18 months older than me, so during that time, Hughes, you were able to pick different programs, and the health program just kind of intrigued me. And through the health program, they expose you to so many different health careers, and nursing just really took an interest to me. So during the exposure, and during the clinical time, was able to get a well-rounded view of what the healthcare system is, but also what the nursing career does. So that was the kind of the start of my my journey.
Wow, that's amazing. Well, you owe your sister a lot then because she pushed you in
Yeah.
the right direction.
Yes.
So tell me, I know I've read some about some of the work you've done around diversity, and these conversations actually started out as a way of us exploring diversity in nursing. And we've talked to so many amazing nurses in many different roles. And so, what I want to find out from you is what was the most, what do you look at as your entry point to learning about diversity? We all know that there's some differences, and you can't grow up in a community of color and not realize that. But when
Mhm.
could you say was that moment where you kind of felt like you realized this was something that you wanted to center your practice around to a certain extent?
Yeah, absolutely. So really, it started with me. With going into a predominantly Black school at Hughes Center, then going to UC was a really culture shock to me,
Mm-hmm.
because I was never around that many diversified backgrounds. So it really started with me and trying to really understand how I fit into this puzzle.
Mm-hmm.
And then as you navigate through nursing, you become just the only one sometimes
Mm-hmm.
in these spaces. And the patients will verbalize and are vulnerable to just wanting to get the best healthcare possible. And sometimes it starts with someone that looks like them and that relates to them
Mm-hmm.
in a manner to where they can get the information to be more of an advocate for their health care. So it started with me kind of understanding how I fit into how I can be a change agent to see better outcomes. I think that people really want the best for themselves, but sometimes they really just don't know how.
Mm-hmm.
So getting that patient or getting that person really just to spend some time with the patients, to really get an understanding as for them as a person, to really just see some change in their health care.
Right.
So really just identifying and really stepping back and being vigilant about just our reality that we are in now.
Exactly. Have you found it to be true? And you can talk a little bit about your experience with this, that it's not just even educating patients. Sometimes it's the colleagues as well. Have you found that to be the case?
Yeah, absolutely. So where I am right now, they actually have an anti-racism initiative
Oh, wow.
where they're having these uncomfortable conversations just around how racism really plays a part into our healthcare disparities. I'm really getting an understanding as looking internal so we can really figure out how that impacts healthcare.
Mhm.
I am super happy and excited that I'm in a space where we're able to have these conversations and to hopefully see some change in health outcomes for our patients.
Yeah, because the conversations are difficult, and I think sometimes, and as a brown or black woman in certain situations and circumstances, you kind of become that unofficial authority on what is happening in a space, especially when you have people that you work with that aren't of color, and so being able to have that conversation and say that this is the way you need to approach this patient, or this is the reason why this is not going to go over well, those conversations, can be really
Absolutely.
difficult. Yeah. I know
Yeah.
one of the things that was mentioned in your intro, you talked about the importance of persons being able to realize that they are recognized as unique individuals, and,
Mhm.
in our, cultures is so important, to be able to have that recognition. And also, then I know that you mentioned not being looked down on or feeling like they're made to be less,
Mhm.
and I think sometimes even small things can make a person all of a sudden feel less. Have you found that to be true even in your interactions and especially with those that you work with in the geriatric population?
Absolutely. So even, going back that we're all human
Hmm.
and figuring out that we're all unique and we all have our own purpose. So when we put that on the forefront, I try to understand my patients from just a human standpoint, and that we all have obstacles, and that we all have a story, and that story impacts how we view healthcare and how we make decisions about our healthcare and other things around us. You have to really understand the patient as a whole in order to really be strategic in their success to their healthcare. So when I look at, patients, I always figure out, what their story is.
Hmm.
I like to talk to them because they're humans first, what they like to do, what drives them, and who's around them that supports them, because all of this are driving forces to someone's success to their healthcare. So when you kind of just step back and just look at them as a person and not a patient, you kind of really get them to understand, or you understand them as a person, and that I strive for the success of their healthcare too. So it just pushes me more to understand that everyone doesn't have the recipe is different for everyone.
Hmm.
That everyone, needs to have a tailored healthcare plan of health, a plan of a care plan.
Right.
So for me, it is just understanding that what drives them, but also what motivates them and what they really understand about their health care. A lot of people, walk around with high blood pressure
Hmm.
and they think it's the normal. They think that is normal. And until you really get them to understand, like, hey, well, my other provider, they're okay with it. And
Right.
just getting them to understand and educate them, like, hey, this is the reason why it's not okay. And these are the things that you can do, even outside of medicine, that can help to improve your blood pressure. So just spending time with them, but really just to getting to understand them and know them is very, very crucial, and to help impact their health care.
Right. And knowing that story definitely makes a difference. And it changes the way they relate to you when they know that you want to listen to their story,
Mm-hmm.
because you value their story and they sit up taller and it's kind of like they feel like you're on the same level, which is great because that's what we want. We want them to
Absolutely.
feel that way. And I like that you mentioned about, high blood pressure. I know a lot of times we'll hear people say, oh, it runs in the family. But, even though there's some genetic components, what might also run in the family is the bad diet, and the poor choices. But
Absolutely.
usually sometimes because nobody sat down and said that we can do something different. So that's wonderful. So
Yeah.
tell me, being that you work with geriatric population, along comes this monster COVID. and you're in one of the most vulnerable sites with a vulnerable population, and also probably dealing with minorities or little groups in that population as well. What has that been like? Have there been unique challenges that you've had to meet?
Yeah, there are unique challenges only because that family is the key to one's recovery. So it really impacts not only the patient but also the families around them too. So COVID was more where I'm at now. They have been impacted by COVID, a lot of deaths, but also looking at it twofold too. The residents, but also the families, and then also the healthcare workers too. So getting everyone on the same accord to help just be preventative, just on those preventative measures, just to make sure that we're doing everything possible to help stop the spread. But with the Delta variant, it is we have not seen a lot of deaths, thank goodness. So for us is really just making sure that we are prioritizing the geriatric population, making sure we're always wearing our mask, hand washing, just because it not only affects the residents, but also the patients too. I'm sorry, the families as well. So just really having proactive approach, having those uncomfortable conversations about vaccine hesitancy, and just really just being vigilant about making sure we prioritize the residents.
Right. That makes a difference. I'm curious, I'm sure there was a period of time when COVID first started, when you didn't have visitors and didn't have the family. Did you have to, or what kind of changes did you have to make kind of in your rounding and practice that were different to kind of foster a connection kind of with your patients?
Yes. So this is a new role for me. In the beginning of COVID, I was in primary care.
Okay.
So it was really intense. In that primary care role, there were a lot of different, it was a diverse population of patients. So for us, we had to look at it from a different lens in regards to just education and prevention, but then also just being real with the patients too. A lot of patients, when they were tested positive for COVID, they still went to work because they had to work.
Yeah.
So, just having those conversations, again, going back to seeing the patient as a whole and understanding that, when I say that you can't go to work, that means they can't pay their bills. That means they can't, put food on the table. So all of these things are a snowball effect to COVID and how it really affects the patient, not from a healthcare standpoint, but, just from a success and survival mode as well.
Yeah, because we had a lot of, and particularly in the, marginalized society, marginalized groups that were just barely making it, just kind of on that edge of survival. And then something comes along like COVID, and it's just, devastating in more ways than one. I'm also curious to know, just thinking about working in primary care, when COVID hit, how difficult was it with dealing with your inner self and the fears that we had as healthcare workers and other healthcare workers? How was that process for you all?
Yeah, it was a struggle mentally and physically. You worry about what will happen to me if I catch it, but also what will happen to my family if I give it to them. So really just being vigilant about educating my family, being vigilant about making sure I'm taking the proper precautions for myself, but also giving myself some grace and a break. For me, it was really tough because not only was the COVID pandemic going on, but also we had George Floyd too. So for me, it was a lot because I've never endured a pandemic and I've never endured that much unjust in both realms. So for me, it was really just taking a step back to really prioritize myself so I can take care of other people, and figuring out what I needed in that space. And understanding that it's okay that we are human first and that we need to take a break from everything in order to be whole.
Yeah, and that's so important. Yeah, that's so important because sometimes I would have to just not watch the news. I would tell my husband I just can't watch it. I'm just in a place now where I can't see anymore because I'm at an overload point, and I need to find a way to be able to put off some of this weight so I can keep going to work,
Absolutely.
and all of that. So it's definitely something that I can identify with. And hopefully we're on the better side of COVID. We're grateful for vaccines. I know that in our communities, that vaccine conversation is sometimes a difficult one to have. My parents are in their 70s, and we had a conversation, and then we had some more conversations, and we kept conversating. And it took them until a month ago to finally go ahead and get the vaccine. And it's interesting because the thing that finally was the tipping point for my mother, and my dad would have gotten it months ago, but they do everything together, they've been together, and that's just how they do. And my mother made the comment to me that, she was thinking about getting it because she didn't want to be a burden if she went in the hospital. Mm-hmm. And I said to her, well, Mommy, you won't be a burden if you go in the hospital because nobody can go with you. And she had not thought about that. So the thought that she would be in the hospital without my father made her schedule the vaccine. So that's where knowing the story, comes in, so knowing that and I had no idea that would do it, but she did, so it's definitely something. And the population that you work with geriatric patients, I'm thinking that probably you can't get out of most rooms without sharing some type of story daily, probably.
Absolutely. Absolutely. Even with the COVID vaccine hesitancy, I've been working alongside the Urban League to address their just to get the information out to us from a trusted source that the community does trust, in order really just to put boots on the ground to really have those uncomfortable conversations. So we even walk the neighborhoods of Avondale and Bond Hill and other places that you just need to go to the people.
Right.
We have to go to the people in order to really have these conversations. So sometimes Zoom doesn't work. Sometimes they're at work when Zoom occurs. Mm-hmm. So going out on weekends, going out in the evenings, and just, walking around, talking with people, just to educate. I think that was it is very, very imperative that we just continue to educate. And then also it comes from someone that looks like them in order for them to make a great decision too. So you got to meet people where they are. Mm-hmm. And sometimes it may just take time in order for them to really understand the importance of the vaccine, or they make an educated decision. So creating that space is very, very imperative. So I think that even in the geriatric population, we do have, staff members that are hesitant. Mm-hmm. But again, creating those conversations in that space for them just to not feel like they're pressured, but also just getting their needs met and those questions answered too.
Yeah, that's amazing. And I love the go into the community thing, because for us, so much is what's there in the face, to be able to see that person and to know that this is a person that cares about you, that looks like you, that identifies with where you are. So the door-to-door walking in the community, I love that. And we need to do more of that. And we will have to do more of that, when it comes to the education part. I want to talk to you also about the Black Nurse Practitioner Network that you founded there in Cincinnati. And one of the things that sometimes happens is when we have organizations form, sometimes people that are outside of the minority group will say, well, why do you need a Black Nurse Practitioner Network? Why can't we just all be in this one network? But you and I know that there's a reason for that. But can you talk to me a little bit about your thought process for forming that and what that experience has been like?
Absolutely. So it was actually just a thought of getting a photo shoot together. It was never a thought of creating a group. It was just one of those dynamic, powerful ideas that I had that I really just wanted to bring into fruition. So and I've had this idea for a couple of years. So I said, well, let me just put it out there. So as I began to have touch points with Black MPs that I know, then it started to trend out and spread. So through there, I think that we have founded over 50, but it was like 17, 18 in the photo shoot. Mm-hmm. So after the photo shoot, everyone said, okay, now what? And, and to me, it was like, I don't know, I said, so, let's continue to, make this airplane as we're flying it. So we really understood that we needed this space to be transparent. We really needed this space just to be us. And really needed the space just for support. So for me, I was always one of two Black NPs that have been in these healthcare systems. So no one really to understand and vent what it feels to be a Black female and a nurse practitioner, not a physician. So all of those were or still are things that we deal with on a day-to-day basis.
Wow. And it's amazing. Having that space is just so valuable because you spoke to a lot there when you think about, being Black and then being a nurse practitioner, because there's a nurse practitioner physician kind of nuance to that as well. The building that I work in, there are 2 Black nurse practitioners. It's a massive staff, in the building where I work, but there's just 2 of us. And so there's just something about seeing somebody that looks like you that's at the table that can have that same experience as you. It definitely makes a difference. So that is amazing that you've gotten to 50 and that it came from I love the picture, by the way. It's just great. I looked at the picture and I automatically felt like I need to be in there with you all. So, the
next one you will.
Yes, I know when I can get to travel, because I mean, it really is awesome to have that kind of space created. So I can certainly see why you got the Nursing Excellence Award, because on so many levels in the community and in the work that you're doing there for the University of Cincinnati, and also even in doing the things that you need to enrich yourself in the profession. You've done so much excellent work. I do want to kind of close by asking, right now we have so many things that we're needing to work on in healthcare. So much of these issues that we have now are issues that have been there all the time. And COVID has kind of pushed a lot of cracks in the foundation to the fore that we can see. What is it in the work that you're doing now that makes you the most hopeful about where we'll be in 5 years or so from now?
I've always been an optimistic person. I've always looked at the glass half full. So for me to understand that, how much impact you really have on a patient's life. And to know that you can be their advocate and you can see the change. So when you see change, it just brings me hope, and I am hopeful that we can touch other people. And by touching other people, that means we can improve our health outcomes. But it starts within us. It starts within just seeing ourselves and understanding what role we have so we can make a difference. So for me, it's all about making a difference and also making an impact. So awards are great. And I'm thankful. But when a patient can understand why they take their blood pressure medicine, when a patient can understand why smoking is not a good choice for them, when a patient can tell me that, hey, I've been dealing with insomnia, but I'm able to sleep 7 or 8 hours now, just getting them to really understand certain aspects in their healthcare and making a difference. And that's what drives me. So there's a lot of work to be done. I'm only one person. But I think with everyone being on board and just understanding that if we prioritize the patients, we can definitely see some improvement is what just brings me hope.
Yeah, you said a mouthful, and that is such an inspiration for the students who'll see this too, to know that there's nothing like that feeling when you've had a patient come in and you give them this, teaching that you want to do to change, and then they come back and tell you how much better they're doing. And it just makes you feel good to know that you were able to do that. So I'm so glad that I had the opportunity to meet and talk with you. So proud of the work that you're doing there. And I do hope that at some point in the future, we'll, when we have projects like this, we'll get to talk and connect. If you ever have anything going on there in your area that you're like, students would benefit from this, we need to have a conversation about this. We have this platform to do this, and these conversations are being archived so that students and faculty will be able to access them as part of the learning process too, because I'm sure you'd agree that there's a lot that we learned when we became nurse practitioners that nobody told us before. And absolutely. So it would be valuable to know these things ahead of time. So hopefully we can be a part of that change together.
Absolutely. It was very nice to meet you.
Very nice to meet you too. And please reach out at any time and enjoy your time there at University of Cincinnati. They're very blessed to have you.
Thank you so much.
Take care. Bye-bye.